My name is Tanya Leon Toscano, and I'm a registered nurse at Valley Children's Hospital. I am also currently in the master's program at Fresno Pacific University. I developed this introduction video for your Chapter 22 unit on mobility and the musculoskeletal system. I like to be able to discuss the learning outcomes. At the end of this video, I hope you're able to identify how growth and development affects the musculoskeletal system in the pediatric patient, in addition to hoping that you're able to describe the nurse's roles and responsibilities in the care of the pediatric patient with the musculoskeletal disorder. At the beginning of chapter 22, there is this quote that is left by your author. Enhancing a child's abilities may enhance his or her strength to overcome anything. When I think of this quote, I think about how kids are resilient, and it's important to understand how they think. If they are in a positive environment, they're going to have this growth mindset, regardless if they have an acute injury or a chronic disorder. That is what I love about pediatrics. Kids want to play regardless of what's going on. And I want you to think about this as we maneuver through the video. Growth and development in the muscles. The muscular system, which includes the tendons, ligaments, and cartilage, arises from the mesoderm in the early embryonic development. So at birth, whether the infant is term or preterm, the muscles, tendons, and ligaments and cartilage are all present and they're functional. The newborn infant is capable of making spontaneous movement, but they lack the purposeful movement. So as the infant matures and gets mobile, the muscles develop further and they become stronger, as noted with these little guys in these pictures. If there are causes for immobility, that this can affect the child's development and the achievement of motor skills, which could lead to motor dysfunction. So an example would be a spica cast on a child that limits them from even being able to crawl or roll, or any other type of immobilization that would affect the development of the muscle that would alter mobility. I like to now look at growth and development in the skeletal system. Here we have pictures of various bones at different stages. The skeleton of an infant is not ossified at birth. This makes the bones of an infant and child more flexible. In infants, the epiphyses are cartilaginous and they ossify over time. In children, the epiphysis is the secondary ossification center at the end of the bone, as you could see with the first bone with the two red arrows. That is indicating those areas. In children, the growth of the end of the bones is where the growth plates are located. So growth of the bones primarily occurs in the epiphyseal region, indicated by the second bone with the two arrows. Anytime that there is injury in this epiphyseal region, it can result in early or incomplete partial closure of the growth plate, which can cause bone deformity or shortening of the bone. So if there's any injuries to these areas of a child, it requires immediate intervention, and so that way we reduce the effects of deformities or alteration in growth. As we look at the continuum of growth, ossification, the conversion of cartilage to bone, and the epiphyseal growth continues until the skeletal maturity is reached, which is during adolescence. Production of androgens, which are hormones, primarily estrogen, gradually causes the growth plate to fuse, making long bone growth complete. And when we talk about long bones are the bones that provide structural support and strength. The femur is a long bone. We've completed the discussion on the growth and development of the muscles and skeletal system. Now I'd like to focus on the roles and responsibility in nursing. Let's talk about the caregiver. The caregiver's role is to understand the pathophysiologic concepts and treatments. You are going to be considered the expert by the family. Let's look at this child who is in Buck's traction. Family may want to know why their child is in this type of contraction. If you've ever seen a child in this, it's very uncomfortable. It creates a lot of anxiety, not only for the family, but for the child, because if the family has anxiety, the child has anxiety. So your role as a caregiver is to provide rationale as to why this child is in this particular contraction, the Buck's traction. So you want to be able to explain to them that it's used to align a extremity. It's there to rest an injured limb or to prevent spasms of injured muscles or joints. So you as a caregiver can accommodate and explain and rationalize why the care is given that the child is receiving. Let's move on to the decision maker. The decision maker is a nurse who is using critical thinking to develop nursing diagnosis, outcomes, and interventions. This is going to help you develop a plan of care. So if we reflect back to the quote at the beginning of this video, what part the nurse takes in the care of his or her patient can significantly affect the mindset of the patient and the family. This is an important role and responsibility of the nurse, and it could establish the whole plan that you have for this patient as they receive care. Now we're going to move on to the communicator, professional, and the advocate. As part of being a team member of a multidisciplinary team, you're always going to have to be able to communicate effectively. And when you do so, you want to do it in a professional manner, because how you present the information could advocate the care of your patient. And you want to uphold the standards within your scope of practice. That's very important. So let's give you the example of a patient who has had a traumatic femur injury. Let's say they were playing football, a 6-year-old boy, and he comes in and he is now in your care and post-op care on the floor. And you are realizing that regardless of how much pain medication you're providing this patient, they're still in an significant amount of pain. And so you also start to notice there's some swelling. Well, these are all components of, or at least signs and symptoms of a compartment syndrome. And so we'll talk more about compartment syndrome in class, but one thing to know is that if you act appropriately in an appropriate amount of time, this can affect the outcome of the patient, because beyond 4 to 8 hours of not doing anything, there could be irreversible muscle damage, and then as time goes on, irreversible nerve damage that could result in the loss of a limb. So your communication, your professionalism, and your advocacy is very important. Teaching, the teacher role is done every day in nursing. I don't know of a nurse who doesn't utilize the skill. Teaching is a major component in that it is how you deliver information to families regarding the care of the child. And so this child's going home with a cast. And so you want to teach them about signs and symptoms of impaired circulation with having a cast. And in doing so, the first thing you want to do is assess who your learner is, whether that be the patient and the family or just the family. You want to be able to identify any barriers. Are there cultural barriers? Are there language barriers? Are there educational barriers? And once you identify those barriers, and you need to present the information, you need to teach them. But how are you going to know if they learned? So then, just as any other classroom, as an instructor does, they evaluate how effective the learning was. So are you going to have them return a demonstration of the skill, or are you going to have them verbalize understanding or repeat what you told them? Those are all important evaluation tools. And lastly, you need to document what you've done. You'll hear that in nursing. If you didn't document, you didn't do it. So that's key. And that's very important. Whatever you do with your patient, you need to document it. Now we'll move on to the manager role. The manager role is a skill, a role that you develop with time. When you come out of nursing school, you're going to be very task-oriented. But I want to challenge you and encourage you to focus on the patient and ask yourself, why am I doing what I'm doing to this patient? And how does that affect their care? Because the manager, you're organizing, you're prioritizing, and you're coordinating the care of your patient. And when you're doing that, you're thinking beyond just, let me get the task done. And so these are beneficial skills as a nurse. So I encourage you to think about that and think of it as sort of managing, the manager role. I want to end with this quote: to do what nobody else will do, a way that nobody else can do, in spite of everything, is to be a good nurse. Um, the significance of this quote is to remind nurses we give a lot and we may not always get back what we put in. But the bottom line is we do what we do because we care. And out of my 21 years of nursing, the biggest reward I felt is always knowing I go to work giving my best. And I mean, how couldn't I? Look at who I work with. Wonderful crew. So I really want you to think about that. And I want to end this video with that. And I look forward to seeing all of you on November 20th. Thank you.